Hello, and welcome to Friday Rounds. I'm your host, Andrew King, and today we are here with Pritika Dasgupta. Pritika is a doctoral fellow at the Department of Biomedical Informatics here at the University of Pittsburgh. So, Pritika, hello.
Hi, how are you?
I'm doing great. Thank you so much for being with us here today.
Yeah, I'm happy to be here.
Yeah, excellent. All right, so our first question is always, what drives you to show up at work every day?
It's the main question. The main reason is I just want to be really adept at handling data and all types of biomedical data types. So the more practice you get with working with data analysis, processing, the better you are at it. And so since we are in research and in academia, like practice is kind of everything. You can't just pick up something and be good at it. Data has like a lot of challenges and it usually takes a lot longer than what people would expect to either clean the data or to understand like what like a variable means in the context of the problem that you're trying to solve. So that's why I show up to work every day. And
So, when you say data, what do you mean?
So for me, I work with gait accelerometry data, but I have worked with other types of data in the past, so such as like epidemiological measures. It can be as simple as having a list of people's ages or a couple of different variables, and you try to see if you can solve a problem in medicine or public health with that. So biomedical data has various types like imaging data, um, qualitative data, quantitative data. And so I pretty much want to be a master of all data types. That's why I'm here. And I want to try to kind of uh, cross over into various different types of data. So, like, not just work with quantitative data or not just work with accelerometry data, but to connect different data types and see what more we can find about a problem. Because usually, when we're talking about a person's healthcare, we're able to collect data on their vitals or pictures of their brain or how they move with sensors. And there are data repositories for people everywhere. Sometimes there's data collected by research teams. They're on a voluntary basis, or data in electronic health records, or surveillance repositories. And I want to see how much we can use to get a better image and a better idea of what's going on.
So, would you call it the fusion of different data types to build a coherent picture of a person?
Yeah. And that doesn't necessarily mean that I use all the data types, but at least I have them. And then I can decide which, factors in those data types are important.
Yeah, that makes a lot of sense. And you said to me something earlier a little bit interesting. You called yourself a data queen.
Yeah, I like when I'm out with my friends or when people ask me what I do or why I do it. I'm like, well, in short, I want to be a data queen, which is a lot simpler than saying, hey, I'm in biomedical informatics, because no one knows what that means.
Yeah, it's tough to be in a field that's not so well known. But
But I think a lot of informaticians are data queens or data whoever
data kings,
data
whichever it
kings
may
or
be.
data masters, and it's like we do try to leverage data and technology in order to try to solve problems, and always trying to. I think also data queen can be a little misleading because I don't try to just look at the data. I try to look at data connected with who the person is or who the patient population is. And I know this is going a little bit away from the topic, but I always feel like when people hear informatics or data or even computer science, they forget that we're serving people, and we're doing this because we want to help people. And sometimes people lose sight of that, and then they try to focus on an app, like building an app, but not really trying to understand, is an app going to be suitable for this purpose.
Yeah,
Maybe.
population they're trying
Yeah.
to actually assist with the app.
Mm-hmm.
Yeah. Oh, fascinating. All right. You mentioned a little bit about your research, but why don't you go ahead and give us a better idea exactly what it is you do every day?
Right. So I analyze gate accelerometry signals from accelerometers, and gate accelerometry signals are basically raw accelerations from how you move in XYZ coordinates.
So gait meaning just the way you're walking, right?
The way you're walking or moving. So it can mean like pretty much all realms of human activity.
So could it be sitting, the way in which you might move while you're sitting, or is it
Maybe like sitting to walking
to
or
a
sitting.
stand?
Yeah.
Okay.
Yeah.
And so you said wearable accelerometers.
Mhm.
So are they like wristbands? Are they? How's that work?
So wearable accelerometers can be placed pretty much anywhere on the body, but the most common place is the lower back in the L3 to L5 region. And so that's just kind of like the lower back where, a lot of people have problems. But the main reason why we put it there is because it captures the movement of the trunk of the human body really well, and it kind of encapsulates just how well the body is moving. But other
the center of mass.
The center of mass, right?
Uh-huh.
But like people will wear on their wrists, and that has been useful as well because people move their arms while they're walking, so it gives useful information. Ankles are another good place, and the chest.
Okay, excellent.
Mm-hmm.
So you're collecting all this gait accelerometer data, and what is it that you're doing with it?
So basically, like the raw acceleration output is a signal. It looks like a wave, and when you look at it, it doesn't really mean anything contextually.
Mm-hmm.
So that's where the data queen part comes in, where I have to try to see, well, how do I separate this out to, steps or strides? How do I mark on the signal where human gait events occur? That's going to be useful for us to know. And also, how do I extract features from it? So like, let's say I have someone walking with some sort of cognitive load, or someone who is of greater age, or someone who is of younger age. How do I differentiate between those signals, and what features do I want to extract from it? So the second part of my research is not just analyzing the gait data, but also performing machine learning methods on it.
All right, so excellent. So you're performing the machine learning, and so why? What is, you said, you can find differences between age, but what is the use case here?
Okay,
that interests you,
right,
or drives you?
the main motivation, because before this PhD, actually, I've never worked with gait data, and I didn't try to choose it because it was signal data is something I've never really understood or worked with. I've never really liked physics that much, but I think what really motivates me is understanding how people walk, especially as they age, when they increase cognitive impairment or load, or have changes in their gait, just because of various biological changes, is an important way to understand why people fall. And falls in healthcare cost a lot of money to treat, and prevalent all over the world, and can lead to kind of like a cyclical cycle of consequences. So like if you have a fall, if you're of an older age and you're already walking unsteady, or there's something else going on, you may develop a fear of falling, which is like a clinically used term. And the fear of falling can lead to a decrease in mental health state. It can lead to a decrease in physical activity, and can...
So is it the fear itself that is reducing the mental health state?
It can be the fear, and also any injuries that occurred with the fall.
Mm-hmm.
And the fear of falling can also lead to another fall. So like a fall can just kind of lead to more subsequent falls.
Yeah. So if you think about what you don't want to do, that makes you more likely to actually do it.
Right.
focus on good outcomes, not poor ones
Yeah.
in general, right?
Yeah, and a lot of research, when they did research on like community dwelling older adults, like older adults meaning maybe like 55 or 65 years and up, they found that people who have had falls tend to not move as much anymore, but then they're not kind of like exercising their body, or if they are at risk for osteoporosis or other conditions, that gets worse because they're not doing the things they would normally do. And that could lead to another fall itself. And so it just kind of cycles into like going to the ER more or having falls, and decreases quality of life. And I think this is really useful in understanding also not just why people fall, but how cognitive impairment can manifest, because the gait is such an essential part of human life, right? And it's controlled by your brain, and so you can understand like a lot of other neuromotor disease like Parkinson's, Alzheimer's, etc.
Yeah. So with the accelerometer data, then you're noticing declines. Like, are you tracking gain differences over time, or is it you have a model of what gain should be, and then if you diverge from that, that means you're at risk?
Yeah, so more right now I'm studying the latter, just because of data availability, but like I do want to gather more types of data to understand the former. So right now, all I'm trying to do is see if I can use machine learning to differentiate between a baseline healthy gait, and healthy right now is arbitrarily defined as someone who is young and able, and is able to do like a certain level of tasks efficiently. Another aspect I'm looking at is how well are people able to dual task. So like walking while talking, or walking while trying to think of something complicated. Like this could be like being on your cell phone. It's one example.
Stepping out in front of traffic.
Yeah.
Is that a decline in cognitive functionality due to our cell phones? But no, actually, I'm familiar a little bit with your research. One of your setups, don't you have a treadmill, probably with an accelerometer on someone, but then aren't they doing math problems while walking on the treadmill?
Yeah, they are. So I have them counting backwards from 10,000 in increments of 7.
Wow.
Yeah.
That's tough.
Yeah, but I mean it's doable. But you have to think. You have to think about it.
It's just it's doing math. It's try to
right.
7 minus 7 minus 7 minus 7. Yeah, and you don't have to count all the way to 0. I'm guessing.
No, it's just for a couple minutes the trial. But there are other research. They have people counting colors or days of the week or other types of math problems, and those are all effective ways to induce cognitive load in someone, especially when you're trying to do a controlled trial where someone is not necessarily at risk for cognitive impairment or is healthy enough, and then you want to induce cognitive load on them, so you control for those variables. But eventually I want to look at people who are doing the same types of gait tasks but across a wide variety of ages and conditions.
No, that makes a lot of sense. And then in terms of the cognitive tasks, it seemed to me, just to clarify that, it's got to be kind of like systems 2 cognitive thinking, not just systems 1, like from memory type thinking. Yeah.
Right. I mean, we did find out that we did 2 trials a week apart, and in the second trial, when we asked them to do the same cognitive task, it was already easier for them because they already know it, right? And so they don't have to think about it as much. So their gait was more similar to their just normal walking trial. Yeah.
Very cool. All right. So if it's okay with you, I'm going to transition to the next question we have here.
Okay.
Fascinating learning more about your research, though. But why did you take this career path?
So it's. I think one of the main reasons is because health and healthcare are really important to me, as on a personal level, but also because it's something where when I was growing up, I always saw that as a problem. So, like personally, I've had a lot of health challenges that I've had to deal with, and I've seen my friends and family deal with mental health issues and physical health issues. I volunteered at hospitals, and so I was kind of surrounded by all these problems. And at the same time, while I was growing up, I was thinking, like, when I went to college, like, what do I want to do? How do I want to hone my skills? In my career. And so I was trying to figure out, well, I'm good at math and science, and I care about people, and being in healthcare, that seems to be a good intersection. At first I wanted to be a doctor, and so it's kind of like, okay, if I want to help people, maybe I should be a doctor, but I got disillusioned with the practice of medicine, and I'm not saying that doctors are bad, of course, but I'm saying that I thought there could be a more immediate way of helping people that would be looking into the processes of how things work, so how people understand data or analyze data, how people understand workflows in treating patients. And so that's kind of where informatics has led to, where I have been led to informatics rather. And also just, I think I do, going back to like the personal front, I have this big motivation to help people in need, because often I am in need of healthcare, and I find myself frustrated by not knowing the answers to what's going on with me, or how do I make my daily living better. And so it's something that I just want to try to alleviate problems. And I've always been interested in elder care, and with falls and everything, is, people tend to develop more health issues when they get older, and dealing with health issues while you're trying to work or do something that you're passionate about concurrently is very hard. For me, on a personal front, I deal with that challenge almost every day, because I have a chronic condition that causes a lot of pain and fatigue, and I don't know when the next flare is going to hit, so I tend to do all my work really fast and all at once, and so that I'll be ready. But it's like I do rely a lot on physical therapy and mental therapy and my doctors and everything, and having that coordinated care system is really important. I wouldn't have that without informatics or without health professionals who care about their patients and who try to connect the dots in my own healthcare. So I think it's a big motivating factor of why I'm here.
Yeah, your personal experience really brings these problems home. And, sounds like you have two major scheduling issues here. Scheduling all your work around when you may or may not have health incidents, and then scheduling all your care. Do you find that difficult? Like you said, the doctors help connect the dots for you. But
yeah, it is difficult because one annoying thing is that I have to go to like multiple specialists and make appointments and everything. And that's why I like being in academia. I have a little bit more flexibility with my schedule, and of course there are like hard appointments that I need to make, but I can set my own hours. I can work when I can, maybe work from home when I can.
Might be middle of the night, not necessarily the 9 to 5. Yeah.
Right. I don't do wet lab work. I do a lot of my work on the computer, and so I can have my computer in bed with me doing work. And I think when I was younger, I wasn't always good about managing expectations and boundaries with people I was working with. I wasn't really forthcoming about, well, these are my needs. But I think as I grow older, I'm getting better at doing that, and that's made my work better as well.
Yeah, can you share maybe an example of a relationship where maybe the needs weren't being met?
Yeah. When I was doing my master's, I worked with like 2 professors in a lab, and I was really excited about the work that I was doing and everything that I was learning. I had a huge drive to be there. But I was going to the doctor, I was going to urgent care, I had all these issues, and I was losing a lot of time just by being ill, and I wasn't able to communicate that effectively and come up with a plan that would help both of us. So help me finish the work that I needed to do and get that across the table to the people I was working for. And, I was flaky and inconsistent, and I'm trying to be better about that here. And I think in the past few years I've been trying to schedule things in more and be really upfront with, hey, I can't do this at this time, but I'll get it done at this other time, and sticking to those promises, but also taking care of myself as well. And I think one of the biggest lessons that I've learned is you can't try to do everything on your own. And I think this goes for people even without chronic health conditions, and especially in grad student life or in academia in general, where I don't know why, but like usually people who excel academically, they try to be perfectionists, or they try to know everything about what they're doing, but that's impossible. You have to ask people for help. You can ask their faculty members or staff members, other students, about their expertise in order to get ahead. And I think that goes along with just the nature of research being you have to collaborate with other people. And so this could be taking advantage of the resources at your university with faculty or the writing center. A lot of universities have like technology center, like we have the CRC, which provides workshops for things you need to learn or people to reach out to, whether it be fellow students to commiserate with, or people to actually help you with your research or even your personal life. One thing that I did when I first got here was get in touch with disability resources, and they helped me navigate those tough conversations with professors. And so I was able to communicate my needs better.
Yeah, if you don't mind me asking, how did you know of your chronic condition for a long time, or was this something you discovered while in grad school?
It was more, it was varied. I've been sick since I was like 8 years old.
Okay,
But like I didn't really know why. And then, I think it became more of a problem in high school and in college, and I still didn't really have a lot of the answers because it's autoimmune. And I just wasn't mature enough in trying to find the answers that I wanted. I would just get really frustrated easily. And then I think over time I just try to find the right people and the right specialists in order to help me understand how to deal with it, give a name to my condition, and move forward.
Yeah, and the reason I ask is just because it seemed like you were still working to find the right system for managing your relationships in grad school. So I was wondering,
I think it's going to be a lifelong process, to be honest, finding a system that works, because with grad school and with anything in life, it's all about interpersonal relationships. And so that's an added element to navigating all of this.
All right, yeah. So, do you have any closing thoughts?
My main closing thought is, again, like if you're in grad school or if you're doing research, time management is a great skill to learn. One thing that I really liked was, I think one of the professors here, Dr. Sham, he told me that something that helps him is that he'll do a retrospective on his schedule, seeing how much time a task actually takes, and then kind of making a note of that. And that's helped me move forward in understanding, well, okay, this actually takes 5 hours instead of the 1 hour that I thought it would take. And instead of forgetting that it took 5 hours, and putting a 1 hour time slot in my calendar. Now I know, okay, this takes this amount of time.
Yeah, that's it. Are you saying you want to learn from the data?
Yeah.
Collect the data and learn from it.
Yeah.
That is
Mm-hmm.
the take-home lesson here.
Right.
Pratika, if people want to reach you, how can they reach you?
So I'm really active on Twitter. My handle is my name, @Pritika Dasgupta. And you can also find me through Andy, because I follow him.
Mm-hmm.
And please follow Department of Biomedical Informatics at Pittsburgh as well.
All right. Well, thank you very much, Pritika Dasgupta. You are the data queen because you are a master of data.
Thanks.
Have a good one.